Good morning, everyone. I'm Shashank. I'm the founder and CEO of Practo. Thank you, Team TiE, for having me over at Pune. I was in Pune many years back. It was another healthcare event. It was the first of its kind in India in 2011 that brought me to Pune. And I'm not surprised with the healthcare-focused event today that TiE is putting together. Pune seems to be the hub for healthcare events. I have not seen a similar event happening in Bangalore. So I'm glad that Pune takes the first stride in all things to do with healthcare. So I'm glad to be back in Pune after a break of 5 years to talk about what we have done at Practo. At an event 9 years back in Chennai, it was a Proto event. It was one of the startup events that I attended. It was in IIT Chennai. I was in the audience like this, and there were multiple companies coming and presenting their ideas. 2008, talking about startups, talking about technology and how technology is changing the game in India. This was 2008. And what caught my eye was that I was the only healthcare company. And people on the stage were talking about social networks, about e-commerce, and about how everything's going to change. And one of the things that caught my eye is that why aren't more people applying technology to healthcare? And when I see today, the landscape is completely different. There are amazing companies who are applying technology to healthcare. I'm talking about startups. Phenomenal individuals, dedicating a lot of their time, skill, and energy towards building innovative solutions for healthcare. And I've come across hundreds and thousands of healthcare startups in India, and it makes me really, really proud. And it makes me look forward to the future that we will have as Indians in this country and the healthcare that these amazing individuals will deliver on. If I might have the clicker, please. Sorry. So what has changed from that 10 years to today, and what has brought all these individuals? I think there's one thing that's definitely changed. At least it's changed my life. And it's brought all these technologies to healthcare, is the penetration of internet. In 2008, when I was sitting in that audience, India had hardly 40 million internet users, or even 30. In 2011, when I was here last in Pune, probably 70 million. And today, we have a proud 400 million Indians on the internet and can access healthcare. And that has been the big change. And this is going to continue to grow, as all of us know, well into the 600 million and 700 million. The fact that internet is penetrated everyone's life is going to change the way healthcare delivery has happened. Healthcare discovery is going to take place. In terms of Practo, where we stand to help mankind live healthier and longer, I'll spend a few minutes talking about what we do and quickly dive into some of the things that I learned as an entrepreneur. So Practo's main goal is to use technology like the internet to simplify ways of being healthy. So for a consumer, we try to see how we can make his or her life on managing their healthcare simpler and easier, starting from an online consultation to booking an appointment or finding a doctor, to actually going into the center and getting a cashless digital experience at the hospital or clinic, and then going on to ordering his medicines online or diagnostics online, following up with his doctor post-treatment, or managing his procedures and his health records on the platform. We try to simplify a consumer's ability, a patient's ability, our ability to manage our own healthcare and our loved ones' healthcare on a simple mobile screen. That's what Practo does. And we try to power all the technologies possible behind the scenes to make this happen. Work with providers, payers, and pharma companies to bring together an integrated healthcare experience for the consumer. So as a consumer, we get a very simple functionality and experience, but behind the scenes, there's a lot of technology at work, partnering with the payers, pharma, and providers. I'll quickly, before I jump into the next section, so this is what we largely do, and I won't get into more details of what we are currently doing. Love to know in the audience, how many startups in the audience today? Okay, next time the question is who's going to start? How many of you startups are focusing on consumers? Okay, wow, that's 50%. So in 2008, I and my family came very close to a lot of healthcare experiences. I was with my dad in a hospital, and I saw a lot of inefficiencies in the way the hospital was run and in the way the treatment to my dad was given. And that's what got me to start in the healthcare ecosystem. But when I started, I made a ton of mistakes. The number of mistakes I make today are still very high, but when I started, I could have definitely prevented many of them. So I thought I'd put together 3 to 4 of these mistakes or learnings that I had and share them with you today. When we started Practo, I was very worried about sharing my idea with people around me. I thought I had this brainwave, and I thought this is going to change the world. I must keep it with myself. And I thought if I share this particular plan with someone, it's going to go away. So we were at this place in Bangalore, south of Bangalore is a place called JP Nagar, where we started off. And in that house, we locked ourselves in, and we kept building the product. Kept meeting only doctors, coming back and building the product. We said we'll never tell anyone anything, and we'll build the product and get it right. We were so worried about sharing our idea that we were in a place where the only thoughts that were coming to us were the ones that from my team and from the doctors. That was the biggest mistake I made when I was starting off. I, on one particular day, happened to meet someone who was really good with products. This was after 6 months of starting up. And I invited him over to see our product. I was really nervous because I'd never shown the product to anybody else. I didn't want the idea to go away to anyone else. And when this gentleman came into our office or home and saw our product, his reaction was, "This is garbage." And it, of course, sank my heart that something that we have worked very hard for 6 months, and the guy said it was garbage. But actually, when we look back, it was actually garbage. And that was a turning moment for us. The moment he left the door, me and my co-founder looked at each other and said, "Dude, this is garbage." And we did a Control-A delete of all the code that we had. We said, this can't be us. And that was the day we started building Practo Ray's first version, which is what today we have with many doctors in the country. So it's important to share your idea, to seek feedback as much as possible. It's important to do action, but it's important to share your idea and get as much feedback as possible, as much critical feedback as possible. As an entrepreneur, that's probably the best thing that can happen to you, if someone is investing their time to give you feedback. And that really helped us. And since then, I surround myself with critics who help make Practo stronger, make Practo better. That was lesson number 1. When we started off, we came across a blog by, I don't know how many of you know David Cox. He's a Matrix partner, one of the best SaaS investors in the whole world. David wrote blogs on how to do SaaS in India, and we were building Practo Ray, our clinic management software. And the only way we could learn about SaaS, because it was just starting off in the US, were through his blogs. So we would wait for his blog to be posted and then implement what he had suggested. So we built a software called Practo Ray for doctors, small centers, and we sold it to them on feet, basically with feet on street, having a sales team. And this was the second big mistake that we made. When we were selling the product on feet on street and we were reading his blogs, which was the only source of knowledge that we had, one day he posted a blog post which said, anybody selling SaaS to small businesses, he had a 2x2 in which price was on one axis and sales methodology was another axis. He said anyone who's selling feet on street to small businesses, he had one small box, and he called it the startup graveyard. He said, "This is the startup graveyard." My heart sank for the second time. I had the right product, but I had the wrong model. And it was a startup graveyard. And this is the only person whom I could learn from. We were in Bombay, in Sitla Devi Road. We had a very small office, just somebody had rented it out just below a staircase. That was how Bombay works. And we had a few of us crammed in there to build the product, to sell the product in Bombay. And when I read that, I said, what am I going to tell my team? Because they're also going to read the same thing. And then I realized that it is sometimes good to go against convention. Context is also very critical. We were building the Practo Ray product not to build a SaaS business. We were building the Practo Ray product for a very different purpose than what the author intended it to be. We were building a larger ecosystem of which the software was the first step. And so it was important that we understood that context. His point of view, the author's point of view, was that model won't scale. And that's why nobody tried it before us, to build a SaaS product and sell it feet on street. People were building licensed products and selling it feet on street to make sure that the unit economics worked out. We sold a SaaS product feet on street where unit economics were either very, very marginally positive or negative. But we did that because it was part of a bigger plan. And we knew from day one that it won't scale, but we still did it. So it's sometimes important to do things that don't scale. It's okay when you're starting off to do things that don't scale, as long as you have a plan for how things could scale in the future. So many of us might get discouraged for trying out new things, especially because things might not scale. And I think sometimes that could be an advantage for companies because nobody else has tried it before. And because we tried it for the first time, we were able to gather thousands of doctors, and that gave us a head start. Because we were ready to try out something that others called a startup graveyard. But we saw context for ourselves, got a differentiator, and that gave us a lead. So important to take feedback in context, and it's okay to try out things in the starting that don't give you scale and that cannot be scaled. So today, we were able to move on and we were able to build a much more scalable model, even though it started off as feet on street. The next one is the failures that we had as product. Today, Practo has built, we probably manage about 10 to 15 products, some of them acquired. I think about 10 products, roughly. But those are the products that survived. We have almost 7, 8 products that we had to kill. We launched them with full fanfare, with as much enthusiasm that it will all succeed, even when we were really, really small. But many of them failed. But I look back at these failures as actually a good thing because we were ready to try things out that were ahead of the time. So as long as you keep experimenting, as long as you're continuously thinking 5, 10 years ahead, I think you'll stay ahead. So the third failure that we had at Practo were the 7 to 8 products that we built that couldn't scale. There was a product called Practo Hello, which was an IVRS for doctors. Didn't scale. We had a product called, I can list the list of products that are in the dead pool today. But what's important is that our need to keep experimenting never died. Even today, we keep experimenting. After every failure, we write a big report on why it failed, circulate it to our teams, and we never make the same mistake again. But we continue experimenting. We continue trying out new things. So I think it's critical that you try new things. It's okay if things fail. Wrap it up quickly, move on. But keep experimenting and don't stop. The last one is one advice that I would share with everyone, every entrepreneur. This has stayed with me for all the 9 years that I have been an entrepreneur, something that I coined called the WOOPIM. WUPIM to me is my framework of making decisions. When a conflict arises, which often it does in companies, how do you decide what to do, especially when they're not in the same level? So these are the 5 levels that I have defined: vision, users, practions, investor, and me. Many failures of ours have been prevented because of this framework. There are a lot of times a decision that you have to take that might be good for the investors, but not so good for the users. Good for the vision, but not so good for your customers. Good for the employees, but not so good for the customer. How do you decide? And so we gave a very clear framework. This is the WUPIM framework. If you have a question around the vision, which is good for the vision of the company, but it goes against your users or your employees, you stick with the vision. And so we use the vision framework across the company to make decisions today. There are many times when something that a customer said goes against what an employee said, or what we call a praction said. How do you decide whom to go with? It's always WUPIM. It's always user before practions. Sometimes, and this is something that I also have put in my board meetings. So my investors know that they are 4th, but at least ahead of me. That way we have an agreement that this is what we're going to follow in the company today. So these were some thoughts that I thought I could share with you on what are the failures, and most importantly, what are the lessons learned, and what are the frameworks that were built to be able to deal with the conflicts that we come by regularly. But I'm also here at TiE to talk about what's in the future and what keeps me excited and what keeps Practo excited about the future. What are we looking at in the next 5 to 10 years? I'm as excited today as I was 5 years back when I was in Pune, because things are only accelerating. It's tough to keep pace. Yeah, but before I get there, I wanted to also share with many in the audience that when I was here last in Pune, we probably had none of them with us. But in the last 5 years, many partners, many investors have joined hands with Practo to drive the company towards its overall vision. So there are many in the world looking at India, looking at healthcare, and are ready to partner with promising companies to take them to their vision. Among these are Thrive Capital and the likes of many other investors. And what they saw in Practo was a new concept, a new idea, which they had not seen before. So there is always capital, investors ready to back new concepts, new ideas that can change the world. So, one of the themes for today is about capital and is about how capital can support healthcare enterprises. And I'm more and more bullish about more and more capital chasing healthcare technology companies and healthcare innovation companies in the coming future. Healthcare overall funding has been on the rise globally in the last many years. And I think that's only going to continue. Someone earlier spoke about Google acquiring so many companies. We're seeing that happen with Google, the Apple, and many other leading technology companies in the world. Healthcare is going to be a big chunk of technology companies' focus and a place where capital is going to reach. So, coming back to the section that I wanted to talk to you about is what is exciting in the coming years. The one thing that's clearly top priority for Practo is this framework of, we saw the first wave of information asymmetry coming in, where Practo helped consumers find doctors, find the diagnostic centers nearby, find the right procedure, the right prices, etc. There was basically a big gap between information that the consumer wanted and he got. He had to depend on people around him or her for that information in healthcare. It wasn't available easily. Today, or in the last few years, the movement has been towards transactions. As consumers have become more and more confident of finding information online, they're now transacting online. And we're seeing that in healthcare throughout. Be it booking appointments, consulting doctors, ordering medicines, getting your home tests done, transactions are taking place. Consumers are trusting online methodologies to be able to transact their healthcare needs. And going forward, intelligence is on the rise, and I'll talk more about that. But today, what we are mostly focused on as Practo is on transactions, on how can we get more and more consumers to be transacting online, which is a way in which businesses can make more money, consumers can get more convenience, and we'll be able to take the use of technology to the next level. And I think the wave after that is going to be that of high usage of intelligence by everyone around in this room today. So just a quick hands up on how many people transact on any of these 4 use cases: booking appointments online, medicine ordering online, diagnostics online, or consulting online. The wave is half there. The rest of you need to catch up. Of this, intelligence is the one that's going forward. What we are focused on is to partner with providers, partner with payers, partner with pharma companies to improve the patient experience. Patient has become the center of the ecosystem. So how can we partner with these 3 different providers to be able to bring better consumer experience online? And that's our first focus, and data is showing regularly that consumers are getting better and better and demanding more better experiences. The second thing that I'm very, very excited about is telemedicine. We are seeing on our platform consumers from 3,000 different towns and villages talking to doctors on our platform on an annual basis, 3,000 places. We are seeing that doctors in tier 1 locations, contrary to popular belief, have a lot of time on their hands. They have about 20 to 30% of the time available to them that they can dedicate to telemedicine. Their time slots are open. And more importantly, technology is now being used to deliver telemedicine in less than 100 seconds. So as Practo, and I'm sure there are a lot of fantastic telemedicine companies in this room here and in India doing this, but one experience that we have had is without a single doctor working on telemedicine inside the company, we're able to connect a consumer with a doctor in less than 100 seconds and do it thousands and tens and thousands of times a month. So doctors are answering telemedicine requests in less than 100 seconds across the country. And so if you're in the middle of the night at 11 o'clock needing a quick suggestion from a pediatrician or from a doctor, you can get it in less than 100 seconds. And doctors, qualified, high-quality doctors, are able to answer that call of yours through a chat in less than 100 seconds. And so this is clearly on the rise, and we are seeing that the next 5-10 years is going to be really high on this. Need to wrap up quick. The other big move that's happening is something that we already spoke today, is about IoT. It was just in 2011 that the number of mobile penetration crossed the penetration of desktops. And this is the year, 2018 is the year in which IoTs cross the mobile. And in a matter of few years, it'll be twice as mobile. And thanks to some data from ARM, we see this becoming 20 times the number of mobile devices. So an average human being will have anywhere between 20 to 30 IoT devices on him. So the next big wave is IoT, which is many of you here already are working on. And what Practo is intending to do is use these IoTs, use these wearables to provide what we call continuous care. We believe this is going to be the next thing that is going to be of big importance, is how can we provide continuous care? IoTs and data moving across the platform, how do we provide continuous care between the payer, the doctor, the pharma company, and med devices, and the consumer? How can continuous care be enabled? And how can continuous care be proposed to the consumer as healthcare as a service? I'm not talking about insurance here. I'm talking about healthcare as a service provided by providers, which can be continuous care for the consumer. where you don't have to go to the doctor, but the doctor will be able to come to you. So this is something that I think is very exciting. We've run out of time, so I want to quickly wrap up. This is something that's very exciting for us, and this is something that we believe over the next 5 or more years, the whole healthcare ecosystem is converging towards, thanks to the move of IoTs and more. The one big concern and one big area of focus for us is to enable this is data security and privacy. And I'm glad that the government is actually laying down very clear guidelines on these, both on the consumer side and on the healthcare front. So with this problem solved, and if the country's regulators take care of this problem, I think all the hurdles for continuous care can be overcome, and the trust of doctors and the consumers on this platform will only keep growing. So that's about it. Every day I get up every day in the morning and picture this, and that's what brings me to work. Someone's life that technology can touch and can integrate both health and care for grandmothers around the world. Thank you, everyone.
Shashank has kindly agreed to answer some questions. Just before that, Suhas Patil in the audience from Afingo, can you just come to this side? There's somebody that needs to speak to you. That would be great. See one of the organizing committee. Thank you. Okay, questions. We already have someone standing. Would you mind introducing yourself and then ask your question?
Sure. Vivek from HealthLeaf, early stage startup. You spoke about your prioritization. When it comes to patients versus providers or others in the ecosystem, how do you prioritize? One, and second, how do you see the adoption of the digital records with your providers? Thanks.
Thank you. I think we all exist. When I say I am referring to healthcare ecosystem. We all exist to serve the consumer. So everyone is trying really hard. Even the doctors, the payers, the pharma, everyone is working really hard to keep the consumer, the patient healthy and out of sickness. So it's our top priority is to partner with them to make that happen. And so that's our decision-making framework. It's our duty to be able to help providers take care of their patients. So the priority is very clear, that we all come together to take care of the patient. So it's absolutely clear to us why we all exist, and that's to take care of the patient. And I think that answers your first question. Now, second question on health record. I think health records are critical. They provide rich data. That's the basis on which ML and AI can be performed. There is a problem with the time it takes to store those records and the intent of the doctors to actually use them. But the problem is not why don't doctors use EMR? The problem is what's the incentivization for EMR? There is currently no incentivization for using health records. So if a doctor can actually see 20 patients, see 10 more patients, I think the prioritization that we laid out just before of taking care of patients comes up first. So there needs to be clear incentivization. So I think that's coming into play now with the payers, with the government and the payers getting more and more active, as well as more and more technology coming into play where the data of EMR can be used by doctors to be able to predict people's health or use that data to be able to provide better health. That's when consumers or other providers will start putting in data. In the US and other places, there's clear incentivization. In India, there isn't. So as quickly as incentivization comes in, either to increase the top line or to increase the quality of delivery, I'm sure that providers will start entering more health records.
Thanks.
Great. One last question, and then we need to move into the break.
My name is Advait. You mentioned about telemedicine. So from a Practo's perspective or from a consumer's perspective, how are you guarding yourself from any legal implications? A lot of malpractice, negligence, people pull doctors to consumer courts. So what's your take on that? Thank you.
I think it is very important to set the expectations very clear upfront to the consumer. Telemedicine cannot be a replacement for a doctor visit. It is not possible for someone to treat the patient the same way he or she could have when they meet the patient. So telemedicine has its own use cases which need not replace the physical visit. There are two use cases that Practo focuses on. One is preventive. If someone has a query, if someone has a question, if someone has an intent to meet a doctor but wants to know a little bit more before he does that, that's where telemedicine comes in. That's one. His queries are answered by a doctor rather than him having to travel. And the second one, and I think another very growing area, is follow-up, where after a doctor has already met the patient, the doctor understands the attributes of the patient, he or she can be able to use the communication channel to take care of his or her patients. I think it's a very powerful medium to take care of your patients post the first visit or the treatment or the procedure. So there are use cases in telemedicine that can be complementary to the current delivery mechanisms that we have today. It need not be a replacement. So that context and that expectation setting with the consumer helps the consumer understand what help will I get and makes the consumer expectation very, very clear. Having said that, the government is also putting into place telemedicine rules, and the associations are putting these regulations in place which will ensure that malpractices are avoided. We also ensure that there are a lot of procedural things that we do to ensure that no misguided information is shared with the patient from a provider's end. So context setting on the consumer side and good technology and regulations on the provider side ensure that there's a meeting of minds on both sides and without getting into trouble.
Great, thank you. Ladies and gentlemen, please give a big round of applause to Shashank.
Thank you.